Greetings, Brother Grand, Marion. My name is Ray Shoemaker. Tonight I'm here to uh, interview and discuss with you issues regarding the COVID-19 crisis. I come to you tonight as a member of an additional nonprofit community organization, Project Elect. Project Elect stands for Enthusiastic Leaders Engaging in Changing Times. And as you know, we're under a time of change, a time of transition, and many call this a time of crisis. First, I want to thank you, Dr. Marion, for taking time to talk with me tonight. I just want to also thank you for all that you've done for our community, for our state of Mississippi and beyond. I'm proud to let our audience know that you are the Grand Basileus of the great Omega Psi Phi Fraternity Incorporated. Dr. Marion also recently and served well as the president of the National Panhellenic Council. Dr. Marion, I understand that you operate a state and regional mental health business known as Marion Counseling out of Madison, Mississippi. So you are very busy, and I want to just thank you for your time and thank you for the opportunity to sit before you for someone that I admire and for someone that I also call a friend. And I just want to thank you, Dr. Marion, for your time.
Well, thanks for having me on, Ray. It's a great opportunity to talk to someone from the area that I grew up in and from where I lived for many years. So it's my honor to be here.
Absolutely. And Dr. Marion, I'll tell you that Tupelo, you're very well remembered and well respected throughout not only Tupelo, but throughout the nation and throughout this city and this state. And when I mentioned the opportunity that I thought I could reach out to Dr. David Marion, there was just an ecstatic response. And so definitely everyone is craving and waiting to see this interview. And I want to just move forward and ask you a few questions if that's okay.
That's okay. I'm ready.
Our focus is this challenge that we are faced with in terms of COVID-19. I'm very fortunate and blessed to have received my second dose. I took the Pfizer vaccination and have had very little, if any, side effects to this point. And I feel very safe, and to the extent that one can feel safe at this point in time. But the first question I have is I can think about in my own home the challenges with being bottled up and having to self quarantine or just to be isolated. It had an impact on me and my family, quite frankly, from a mental health standpoint. My first question to you, Dr. Marion, is what are you seeing as a mental health professional in regards to the response and a mental health kind of prognosis, mental health status of individuals who are either suffering or suffered from COVID or that have been quarantined due to the effects of COVID-19?
Well, certainly what we've seen is an increase in depression. I would say an increase in anxiety. Unfortunately, an increase in domestic violence and sexual abuse. Um, there were always issues with that prior to a pandemic, but we've seen the pandemic, exacerbate those kinds of things, an increase in homicidal ideations and intentions, and again, unfortunately, an increase in suicidal thoughts and acts of suicide, not only with adults but even amongst our children. So, if you really think about this, we've been dealing with this pandemic for a year now. And so back in March, everyone thought that it would disappear in the summer, if you remember it, that viruses don't survive well in heat, is what we were told, even by the experts. But here we are. We've gone through that summer. We've gone through a winter where there was great concern because of the flu epidemic. When you added the two together, that you would certainly see the number of cases surge. And now here we are a year later. But fortunately, like you just mentioned, there are vaccines here now that we can take to protect ourselves from this coronavirus.
Thank you, Dr. Marion. You mentioned the wide spectrum of populations that are impacted, in their various pockets regarding to COVID-19 virus. And I know that as part of your mental health practice, you work with youth, whether in a private practice or with school systems and in other group settings as well. What have you seen in terms of that population? As it relates to the response to the fear or the impact of COVID-19 in the personal lives of our young folk.
Well, I think they've suffered in many ways. They've suffered academically. I'm not sure when we will be able to measure, and if we're able to measure accurately, what a virtual education, um, how equivalent it is to in-person learning, what that will look like for years. But if you think about it, we've had one class of seniors to graduate during a pandemic, and we're positioning ourselves for a second a class of seniors who don't know a lot about the prom and those kind of events that they tend to really enjoy their last year. But how prepared they are to go off to college, how prepared are elementary school students that have gone off to middle and middle school students who are in the eighth grade, coming high school freshmen. We just don't know the impact this has had on our kids academically. And if you also remember that first, at least here in Jackson, when it first hit, lesson was taught by people coming up once a week to pick up their packages, picking up whatever their assignments were for the week.
Right.
So really parents had to become teachers.
Okay.
And the stress of trying to go to work and then run a household and then be the teacher as well has been impactful. I think kids being isolated from their friends. School is, I remember back when I was growing up, school was where you got a chance to socialize with your friends.
Right.
We lived out on Highway 8 in Gibson, Mississippi, which was about 8 or 10 miles from Aberdeen, Mississippi. And
Okay.
Aberdeen was the city. So imagine if you got isolated out there in Gibson and couldn't go to town. You know what I'm saying? What that would be like. And that's what we've seen our kids not being able to go over to visit with their friends and socialize with them and learn with them. The impact, I think, is still being measured.
All right. I grew up in a rural area, and my dad's a Vietnam vet, and my mom's a co-art school teacher. And initially, my response to my kids was get over it. So what? You don't have a problem. If this is the worst thing you're going to experience in life, you've got life figured out. But I found out through the process that was not the right approach. And so, Dr. Mayer, what advice would you give a parent who has a family and have children that may have signs that that you can see directly, or those that may not have signs? What advice would you give a parent in dealing with the youth regarding to COVID-19 and some of the concerns?
I would say not be judgmental, not project your beliefs about things onto them. If we are all honest, we've been afraid during this pandemic.
Absolutely.
Imagine feeling like if you went anywhere, you could touch something. You could walk in a hallway that was empty, but may not have been 5 or 10 minutes before, but there's no way for you to know, and that somehow you could catch COVID. Then, if you remember, I never will forget that example that Dr. Jerome Adams, the Surgeon General, demonstrated how you can turn a bandana or a piece of cloth into a face mask, only to learn that those weren't the best face masks to use. So many of us, I would suggest to you, I would even say myself, the traveling that I was doing prior to March of 2020 was enormous.
Okay.
I remember being in Little Rock, Arkansas in that January, flying to Washington, D.C., because Zeta Phi Beta was beginning to their celebration that year of their 100th year. And I went there. I remember going to Dubai and going through all the various countries to get to Dubai. The weekend before this was announced as a pandemic, I flew to Atlanta, flew from Atlanta to Detroit, Michigan to speak to the brothers, flew from Detroit, Michigan to Selma, Alabama for the anniversary of the march across Edmund Pettus Bridge. And so the next week they tell me, hey, we're in a pandemic. I was afraid. Thought about all the places I had been, and I knew that I should have caught it. But if we're honest, it's only been by God's grace and mercy that many of us didn't get this dreaded virus. And so I think parents have to be not judgmental when they talk about this. They have to listen to their kids. They have to process that information. They need to do for them because we know they're afraid. My daughter said she wasn't going to come out the house until it was over. Well, guess what? It took a long time for this, and it's still not over. So eventually she had to come out the house, right? But we have to listen to them. We have to be patient with them. We can't be judgmental. Feelings are what they are. They're feelings. They're not right or wrong. And so we can't judge them for having the feelings that they have in this anxious environment that we live in.
Thank you, Dr. Marion. Dr. Marion, you're recognized nationally as well as internationally, and you have many people under your leadership. And for individuals that are in a leadership role at their level in the public workforce or just some form of business, what would you advise them on how they deal with their employees in this crisis?
Well, I think again that, for me, I had to understand that a lot of my employees had underlying health issues.
Okay.
We know that although African Americans make up 12% of the population, we made up 40% of the COVID-19 deaths.
Okay.
And so when you think about that and think about all of the health disparities that we already were experiencing in our community, and now to have COVID kill us and be infected at higher numbers than everyone else, is a lot to think about when you talk about the people that you employ. We certainly don't want to miss a dime, don't want to miss a dollar. We're trying to
Right.
make it too. That's what you heard from landlords that were talking about not being able to evict anybody who doesn't pay rent. That's great for them, but what about me, who's a landlord? You heard that cry out. I think as an employer, we have to be sensitive to our employees' needs and be honest about their underlying health issues and try to figure out ways that they can work from home. We had to do an entire shift in March of 2020. We were used to providing in-person services or in schools, face-to-face. And all of a sudden, we were faced with doing services either by telehealth or not at all.
Okay.
And so we were blessed to be able to do that. But it takes a lot of patience with folks and understanding that they are afraid they could come to work and die.
Right.
That's what they're afraid of. And that's real. So as an employer, I have to strike a balance between how do I find a way for them to work while at the same time advocate for them given their health concerns.
Right. Thank you, Dr. Marion. Dr. Marion, the next question I have for you is in the African American community, particularly the African American male, we have some challenges with our past and how we felt we've been treated and been experimented on and experimented with and those sorts of things. And so I hear a lot in the community that individuals, African Americans, refuse or do not plan on taking the COVID 19 vaccination. And I struggle with trying to figure out how to get our folk beyond the stigma of things of the past. How do we get past it? I know there's no crystal ball, but how would you respond to that, or any advice you can give us in our community how to deal with those sorts of challenges?
Well, part of the problem right now, I think, with trying to get to a place with this pandemic where we could return to some level of normalcy is what you're just talking about, which is vaccine hesitancy. If you had asked me in March of 2020, if when they came out with a vaccine, would I take it, I would have told you no. But I always think people always need the best information. And I think oftentimes and this is my saying that I tell people all the time: when people don't have information, they use their imagination.
Okay.
And so, back in March of 2020, I would told you about the Tuskegee experiment and how that went on for 40 years, with these black men being unaware that they were being experimented upon. I would talk about Henrietta Lacks, who procedures were done on her without her will and without her knowledge, as it relates to cancer research. I think about Fannie Lou Hamer, who went in for one thing and came out, and could no longer have children. And we know in Mississippi that's big, where women would come out, and not be able to have children anymore after surgeries. I understand the history. No one has to tell me about putting smallpox in the blankets for Native Americans. I understand that history to that this government has sanctioned at times to kill black and brown people. But what I started doing and what we did in Omega was there was a COVID-19 task force that was formed in the second district, New York and Pennsylvania and Maryland and those states up there. It seems like I'm leaving something out. But anyway, they meet every week. And on that call are COVID-19 experts.
Okay.
I wanted Omega to form their own scientific team. And I wanted to know what this vaccine was about, who participated in the trials, what is it made up of, what have they really seen, how it affects people, all people, and then people of color. And the information that I learned probably from March till about, I'd say maybe August, changed my tune from not taking the vaccine to I'm going to take it, but I'm going to let y'all take it first, and I'm going to see how it's going to affect you. You know what I mean?
Absolutely.
A 5-month period of listening to these experts, telling me the ins and outs, answering every question I had, my tune had changed.
Okay.
What happened from August through about December, my tune changed from I'm not going to take it, I'm going to let y'all take it and watch what happens, to as soon as it's available, I'm going to take it. Because I saw too many of my brothers dying from COVID-19. I saw too many of them fighting COVID-19. We've had a lot of deaths in our fraternity over this past year that are related to COVID-19. In other words, they would not have died. They'd still be alive had it not been for COVID-19. And so once I saw that, and I had learned everything I knew about it from physicians, from scientists, from pharmacists, and on down the line, my comfort level went up, and I had the information that I needed to know. And so I took my second vaccination early February. And so I feel safer. And it was Dr. Sanjay Gupta that really made it real plain to me. He said, you know, we use a lot of the PPEs. We do the masks, we do the hand washing, we do the hand sanitizing, we do the social distancing. But imagine how your life would change if you were able to put a PPE on the molecular level.
Okay.
And that stuck with me. And so now I have a PPE on the molecular level,
Gotcha.
in addition to the mask, in addition to the other things I'm doing. And I feel safer than I've ever felt during this pandemic.
Okay. And so you agree that being fully vaccinated does not give a license to take off your mask? Is that what's your? I've heard comments out in the community that the individual's fully vaccinated, so their thought process is, "Hey, I don't need a mask. I'm vaccinated, and so I can't catch the COVID-19 the second time."
So from those same calls, I learned that I could still be a carrier. And I thought that was important for me to know, because I had 3 trips that were scheduled. Once I got vaccinated, I had 3 trips. One was to Raleigh, Durham, North Carolina, to
Okay.
speak at a church there at the end of Black History Month. And I was supposed to go to Montgomery and meet the Secretary of the Army. And I was also supposed to go to the funeral of Chico Arenas, one of my dear friends of 22 years, who died because of COVID-19. But my wife made the point, and I thank God that I'm always open to hear reasonable ideas. and still believe I don't know it all. But she made the point, yeah, you're vaccinated, but it doesn't stop you from being a carrier, and you could bring it home to our 12-year-old who has not been able to be vaccinated. So yes, I'm vaccinated. Wear the mask every day, washing my hands and sanitizing my hands, social distancing, just like I always was doing during this pandemic. It doesn't give me a license to take all of that off.
Awesome. Good deal. So, Dr. Mayor, I would like to switch back to just the direct mental health piece. And before I go into that, you mentioned some trends, and I understand that there's trending in domestic violence. There's probably trending in depression, increased depression, and there are several things that we can see as a byproduct of this dreaded COVID-19. Even suicides. I think we've seen an uptick in suicides, and I noticed that you have had to kind of pivot your practice to provide the service at a different offering, whether it's telehealth and phone and those sorts of things. So, do you consider that the new trend in the healthcare delivery system, either in this period of time or beyond, the ability to provide mental health services from anywhere, whether it's telehealth, by phone, etc. What are your thoughts in terms of the paradigm, the shift that's been forced upon us for making it through COVID and post, if there's a post-COVID environment?
Well, I think there's always something to learn from all of our experiences. And so you mentioned I serve as chairman of the Council of Presidents of the Divine Nine. And all of us have talked about that there are going to be some elements of how we conducted business during this pandemic that we will continue to employ going forward. And I think it kind of parallels what we're talking about here with mental health. There are individuals who may love to come to meetings or may love to come to in-person sessions, individual, family, group, but can't come either due to health issues or mobility issues. And so we've seen the attendance of our older population in Omega come to more meetings, participate in more events because they could do so virtually.
Okay.
And so it is with in the mental health field. I think with some, they need face to face.
Okay.
They need to be in your presence. They need to talk through some issues. They need to hear your perspective, and they need to do that in person. But many others that I serve, because I still provide counseling services myself. Many others are glad that the services are being given to them by phone, by FaceTime, by Doxy Me and Zoom, and I can't think of a WebEx and those other forms. They like that because they're sitting in their home. They're sitting on their couch with their feet up, having a session with their therapist that is just as real as if it were in person. So they really value this opportunity. So there really hasn't been a break in service for people because they could not come as there normally would be if they could not come. Now we've just figured our way to deliver those services. I think it's going to be here to stay. I think some insurers might try to not let that happen because of the cost involved.
Okay.
But I think if you were to ask the beneficiary, the patient, the client themselves, I think they would want some form of this to continue.
Okay. And I totally agree with that. I think this is going to open up another level of acceptance
Mhm.
and it's access that otherwise may have been frowned upon. But this is a situation where we can see there's a pivot in the delivery system, definitely as relates to mental health.
I think too, it's always been here, just not to this degree. You'll know that for example, in rural areas,
Right.
who could not get their hands on a psychologist or a psychiatrist, if they went to their doctor's office or went somewhere locally, they would get in front of a camera and talk to their psychiatrist or psychologist and have evaluations completed, have medications prescribed, all of that. And so we just haven't stopped providing those services, and I just think they're going to be here in a greater way once we get past this pandemic as we see it today.
Absolutely. Dr. Mayer, I've just really enjoyed this time talking with you. I know you have a very, very busy schedule. We wanted to reach out to an expert such as yourself in the field, well respected nationally and internationally, regarding and in the field of mental health. And what you've shared with me in this interview has been very helpful, and hopefully will be helpful for our listeners as they understand from an individual standpoint, in a role as a parent or also as a business owner, as it relates to dealing with COVID 19 and the impacts it has had on our community and our families across the board. So, is there any last bit of advice you'd like to share with us or comments regarding COVID 19 and the time that we live in before I close the interview, Dr. Marion?
Well, I think, again, this talking to folks in an area that I grew up in is big. My father moved us from Los Angeles, California in 1970 to Aberdeen, Mississippi.
Wow.
And that is where I graduated high school in 1978. Lived in Tupelo multiple times. Glenkirk Apartments comes to
Okay.
mind is when the time I think of Tupelo, Mississippi. Tupelo was where I worked. I worked at Behavior Health for many years, which is a part of North Mississippi Medical Center. When I opened my first office, my first outpatient mental health office, I opened up two. One was in Tupelo, right up above Shoney's, and the other
Okay.
one was in Columbus, Mississippi. And so, and then my office moved downtown. So I've worked in that area for many years, trying to help families. We know COVID-19 has taken a toll on people's spirits. But, we are seeing some light at the end of the tunnel.
Okay.
We do know if we follow those rules of using a mask, now they're recommending double masking. But we know if we put on a mask, if we sanitize our hands, if we wash our hands regularly, and if we social distance, if we do that consistently, that we have been very successful to not catch this particular virus. We still tell people to do that. If you have mental health needs, we still tell people to seek out mental health resources in your area. The stigma is not that you need help. The stigma is knowing that you need help and not going to get it. So glad to have been on this interview with you.
Dr. Marion, thank you for your time. I know I don't understand how you get it all done, and interesting to see that even in this interview, it was revealed that you also continue to provide services individually, in addition to
Mm-hmm.
operating a practice. And with all the things that you have on your plate, you're wonderful and a man that I admire, someone that I'm glad to call my friend, and definitely my fraternity brother. And I want to thank you for your time and all that you do for our communities. And I look forward to talking to you again. Thank you, Dr. Mary.
Thank you so much, Ray.
Have a good one.